the Health Secretary, Mr. Deputy Speaker. Seriously, which bit of all this is actually world-beating, other than possibly the £10 billion price tag? So, Mr. Deputy Speaker, while today's vaccine news is encouraging, we still have a long way to go. We need mass testing, and we welcome his commitments on that front, but will he also undertake to expand the rapid testing consortium so more British suppliers can be involved in that, because many complain that their test kits and the regulators spend ages to give their test kits to sign off and their emails go unanswered. We need an effective tracing regime. So rather than the ad hoc system we have at the moment, with all this money going to privatised firms, why does he not put local directors of public health in charge, backed up with primary care? We need to be preparing now for the second wave, Mr. Deputy Speaker. We already have one of the highest excess death rates in the world. Lessons need to be learnt. I hope the Minister is learning them.
Secretary of State.
Well, Mr. Deputy Speaker, he was doing so well when he was supporting what we were saying. I'm grateful to him, Mr. Deputy Speaker, for support on what we're doing on vaccines. And I'm also grateful to him for his offer to stand shoulder to shoulder against the anti-vaccination movement. Those who promulgate lies about dangers of vaccines that are safe and have been approved, they are threatening lives, and we should all in this House stand shoulder to shoulder against the anti-vax movement. He asks about if there is no vaccine, and of course, if there is no vaccine, and no vaccine can be guaranteed, if there is no vaccine, then the next best is good treatments. And we have the first treatment here in the UK, dexamethasone, and we have promising news of another today, and we put all the support we can behind the finding treatments. And in fact, the UK recovery trial is the biggest and I would argue the most effective treatment clinical trial for COVID-19, again, in the world, because from the start of this, we've backed our science and we've supported our science, and with the help of the NHS, we're able to do this scientific research with great rigour here. He mentioned the sage advice from March about lockdown. The sage advice that the CSA was referring to was implemented. That was precisely the point I was making on Thursday, and did so very straightforwardly. It was implemented straight away. If he looks at that sage advice and what happened, that's what he'll find. I seem to remember at the time, Mr. Deputy Speaker, he supported the action, and maybe it's now that he's looking in the rearview mirror. He should spend a bit more time looking forward, not looking backwards. On social distancing, as on Leicester, he asked about the data and thresholds. We use all of our data. We use all of the data that's available to make these judgments. We don't put numerical thresholds on any particular figure. We use all data and we make the judgments based on those. He also asked about data being made available to local authorities. On Thursday last week, I said I was going to provide more data to local authorities and wanted to provide more data to local authorities, and we've done that today. We had provided identifiable information to patient identifiable information based on postcode level testing, and now we're able to provide full information, including the name and address of those who tested positive, to local authorities where they have signed a data protection agreement. He talked about the effectiveness of NHS test and trace. He needs to stop for a moment and recognise the enormous impact of NHS test and trace and the 180,000 people who they've been in contact with to advise them to isolate. In Blackburn, yes, it is hard sometimes in certain areas to find all of the contacts, and so we'll be sharing with the local area the information on those who NHS Test and Trace hasn't been able to contact, so that local directors of public health will be able to support the action there. Again, I think his tone on that of sniping from the sidelines ill behoves the enormous effort and the previous work he did to support these things across party lines. Finally, he asked about what we've learned. And the thing that I'd say that he needs to learn, and I've certainly learned, is that things go best, Mr. Deputy Speaker, when you get the work of the public sector and private sector coming together. The attempt to divide us that is put forward by the member opposite, who doesn't even believe it himself, but uses this argument just to play to his base. Honestly, there are more important things going on. And, you know, we've set out a direction. We're going as hard as we can down that direction of travel, and we've announced to this House further action in that direction of travel. He should get alongside.
If questions and answers could be as concise as possible now, we will hopefully get many more members in. Jeremy Hunt.
Mr. Deputy Speaker, this may be the last coronavirus statement before the summer break, so I want to congratulate the Health Secretary on his stamina over the last 6 months. And in particular his decision to introduce the 100,000 test target in April, which I think will be seen as a turning point in our battle against the virus. The central challenge we now face is, according to the latest figures as he knows, about 1,700 people a day are being infected by the virus, and about 400 a day are going into NHS test and trace, which is about a quarter. So as we think about how to prevent a second wave, could he give the House some details as to how we're going to bridge that gap so that we can hopefully go into our Christmas holiday with the same cautious optimism that we're going into our summer one?
Yes, Mr. Deputy Speaker, this is a really important point, and we monitor those data all of the time. I'm glad to say the latest data are a little bit better than my right honourable friend suggested, but the point is still important. The main cause of the gap is people who are asymptomatic and therefore don't know that they've got the virus and don't come forward for testing. So we're going to ramp up our communications to people, if in doubt, if you think you might have the symptoms, to come forward and get a test, and of course ramp up our asymptomatic testing of high-risk groups that he and I have had exchanges about before. I'm very grateful about what he said about the 100,000 testing target. Of course, he'll, I'm sure, recognise that I'm as delighted as he will be that the Prime Minister set me a new target on Friday to hit 500,000 by the end of October, and that will be so there's my summer sorted.
By video link, Dr. Philippa Whitford.
Thank you very much, Mr. Deputy Speaker. I too welcome the progress being made regarding vaccine development by research centres and companies across the UK, including Valneva in Scotland. But a widely available vaccine is still some way off. In the meantime, avoiding the social and economic impact of repeated local lockdowns depends on driving down community transmission. Professor Dominic Harrison, Public Health Director of Blackburn and Darwin, has highlighted that only half of contacts are being traced by the central system and calls to be given information on individual COVID cases so their contacts can be traced and isolated in the short window before they too become infectious. In the COVID statement last Thursday, I again raised the issue of delays in providing individual test results to local public health teams. He said he couldn't answer so many questions from me, so chose not to answer any. So to make it simple, I will ask only one. Postcode information was utterly insufficient. So by what date can he guarantee that every single Director of Public Health in England will receive the identifiable details of all new positive cases on a daily basis?
If they've signed a data protection agreement today.
Wheeler.
Thank you very much indeed, Mr. Deputy Speaker. My South Derbyshire constituents have strong links with Burton and Leicester. In the light of the recent spikes of the COVID virus there, what steps is my right honourable friend taking to ensure that local authorities have the necessary powers to take local action to control the virus? And does he agree that that localised action will now be key to managing the virus as we move forward?
Yes, I agree strongly with my honourable friend. She makes the point very clearly. And no matter the level of new infections in any area, having better and better data helps us give more support to those who have coronavirus. So whether it's that there's an outbreak with large numbers, as we saw, for instance, in Leicester or in some other cities, where there's clear concerted action with the support from national government to go in and rooted out, or whether it's an area with very low levels of background infections, like her own, where the local authority having this data will allow them to go and support the few positive cases they get. That either way will help the coordination of the national and the local response. We've said all along this is best done by the national level and local level working together, and I'm really pleased that we're able to get this increased data out so that we can increase that coordination still further.
Kerry McCarthy.
I want to thank the Health Secretary while I have the chance for two things. One is the deal on Kaftrio for cystic fibrosis patients, which is so important to so many of them, and also for meeting my constituent Jake Ogborn recently to talk about access to the drug Spinraza, and I hope we have some news on that soon. But for people in those with conditions like that who have been shielding for the last few months, there's still a great deal of uncertainty, concern and confusion about whether it is safe for them to go outside now or what they can actually do, especially when other people are breaking social distancing, not wearing masks and so on. So what reassurance can he give people that they would be safe if they did tentatively put a foot outside?
Mr. Deputy Speaker, I pay tribute to the Honourable Lady's campaigning on these issues, and we've worked closely together to bring really positive news with respect to the treatments for cystic fibrosis that she has campaigned on so strongly. And also she's made the case very clearly on Spinraza, and I have since discussed that with NHS England, and it's of course their statutory responsibility to take a decision, but I've discussed it with them as I committed to her and her constituent Jake. What I'd say to all of those who are in the shielding category is that the reason that we have recommended that the shielding restrictions come to an end at the end of this month is because it is clinically advised that the levels of new infections are low enough that it's safe to do so. It is safe to do so. And if I could make a plea, I would plea to those who are shielded, please listen to this clinical advice, because we also know that staying at home and not seeing other people has downsides to your health too. And if you want proof that we won't do it, we won't make this step unless we are confident that it's safe. In Leicester, where the rates of infection are higher, we have paused the end of shielding for exactly the reason to keep people safe, so people can have the reassurance, the assurance that it's safe from the end of this month, if you're in the shielding category, to go out into the community, taking the precautions that everybody should take.
Joy Morrissey.
Thank you, Mr. Deputy Speaker. May I congratulate my right honourable friend on the significant drop in hospital admissions. And as we continue to come to grips with this virus, will my right honourable friend agree with me that local response and local action is key to preventing and containing future spikes? And will my right honourable friend join me in praising the excellent work of Buck CCG and our local authority in working together to create a joint action plan to keep admissions rates low?
Mr. Deputy Speaker, I'm very pleased to be able to congratulate all those working in Buckinghamshire, the Council and the CCG and the other parts of the NHS for the work that they're doing to keep Buckinghamshire safe. The number of infections across Buckinghamshire is very low now, and we want to keep it that way. If I can also take this opportunity to answer the part of my honourable friends from Derbyshire's answer, who I didn't answer, which is that more powers will be available as well. Not only more data, but more powers to local areas to be able to do more of the local action themselves without having to refer up to the Secretary of State to use my powers. Of course, there are further powers that we hold in national government for very significant action that we've had to use just the once, but we're going to give local areas more powers as well as more data to be able to really grip this locally.
Video link. Dr. Luke Evans.
Thank you, Mr. Deputy Speaker, and I'm grateful to my right honourable friend for his announcement today and congratulate the scientists who are looking into the research to hopefully solve this COVID problem. On Friday, he announced that there was going to be review into data from public health regarding deaths, which I think is incredibly important. Could I ask him, does he have any indications on how inaccurate that data may be? And if so, how that's likely impacting the planning for the future to deal with the COVID response?
Deputy Speaker, I don't have anything further to add yet. The problem was that anybody who had COVID at any point and then subsequently died, whether or not from COVID, was being counted in this data, which right at the start of the crisis was a perfectly reasonable approach to take, but clearly needs to be reviewed. It does mean that it is likely that the number of deaths has been overestimated on this measure, and hence the urgent review, and I hope to have more information this week.
Kate Osborne.
Thank you, Mr Deputy Speaker. We know that for some, the recovery from coronavirus can be long and often bring with it debilitating symptoms, including fatigue, headaches, pain, etc. So can I ask the Secretary of State, what additional support is the Department giving to GPs to help them have the necessary resources and support to care for patients that are suffering with long-term symptoms and helping them to come to terms with, cope and readjust where necessary?
Yes, the Honourable Lady asks a very important question because there is increasing evidence that there are some long-term debilitating consequences of having had COVID for a minority of people, and for that minority it is very, very substantial, including at least one member of this House. We've therefore started a whole NHS service to support people recovering from COVID who have long-term symptoms, and primary care is, of course, an important part of the service that the NHS provides.
Jason McCartney.
Thank you, Mr Deputy Speaker. Up to last Friday, the rates of COVID-19 infection had dropped in Kirklees over the previous 7 days. But we've had recent outbreaks, raising fears from my Colne Valley constituents of local lockdowns. Does my right honourable friend agree with me that timely postcode level data will assist Kirklees Council's Director of Public Health and all their officers, who've been doing an excellent job, by the way, so that they can continue to target the outbreaks with local measures in our community?
Yes, Mr Deputy Speaker, that is exactly the plan, and they got that data at postcode level last week, and they'll now get more, even more detail, including the identities of people who've tested positive, so that they can support them and work with NHS test and trace yet more effectively. Kirklees has been proactive in how it's managed the outbreaks it's had so far, and it had outbreaks about a month ago that it got right on top of, and is working very hard now in the current circumstances.
Video link. Patricia Gibson.
Thank you, Mr Deputy Speaker. Yesterday saw the single largest daily recorded number of global COVID cases, as well as a protest against masks on the streets of London and an illegal rave attracting thousands of people outside Bath. How does the Secretary of State imagine that he can persuade people, the public, to get behind his government's public safety message?
Well, I'm glad to say, Mr Deputy Speaker, that the vast majority of people respond positively to the public health messages that we've been putting out throughout, and it's a very important part of the policy.
To Deputy Speaker, the Secretary of State reminded us of the importance of a vaccine, and I was interested to hear on the radio as I drove into Parliament today a representative of a drug company saying that we may have a vaccine by October, and a doctor based at a university telling us that today is a great day. Does the Secretary of State agree?
I am cautiously optimistic. The team are optimistic. And my job is not to speculate on the likelihood of the Oxford vaccine coming off. It is to make sure that, should it come off, we are ready.
Munira Wilson.
Thank you, Mr Deputy Speaker. The £3 billion for the NHS is, of course, very welcome, and he has rightly, passionately spoken about protecting the NHS. But if I could respectfully remind him, he is the Secretary of State for Health and Social Care. And I have real concerns about social care being overwhelmed if there is a second surge, with hospitals having to very quickly discharge people into the community, as we've seen with the first wave. So please, can he tell the House what further measures and package of support will he announce for social care?
Of course, it's important to support social care as well, as we have financially throughout this, right from the start. And in terms of the discharges from hospital, of course, the vast majority of those were into the community with care packages. So social care is also a very important part of this. We announced the money for the NHS last week, but we continue to look at what we can do to support social care too.
Andy Carter.
Thank you, Mr Deputy Speaker, and can I thank my right honourable friend for the update he's given today. Particularly welcome the news with regards to the vaccine programme. I wonder if I can ask the Secretary of State to provide us with a little bit more detail about the work being undertaken to look at the risk of getting the virus again. How long does he think it will be until we know whether having antibodies will give us some form of immunity?
Very much, Mr Deputy Speaker. Well, we are undertaking this research into immunology. It's incredibly important for not only for people like me who've had the disease to know the likelihood of getting the disease again and the likelihood of transmitting it again. And both are very important for obvious reasons. One for personal health, the other for the public health. But it's not just about the antibody response. It's also about the T-cell response. Both of these are different parts of the immune system responding. We are making progress in our understanding of that, but not yet enough to be able to recommend that people who've had the disease or have antibodies act in any different way to the rest of the community.
Antoniazzi.
Thank you, Mr Deputy Speaker. 26th of June, letter to the Secretary of State from the co-chairs of the APPG on medical cannabis about the desperate plight of epileptic children due to COVID. 9th of June, an urgent email to the Parliamentary and the Secretary of State following a meeting at the suggestion of the Secretary of State in this House on the 2nd of June. 22nd of May, a joint letter from 8 cross-party chairs of cancer APPGs about an urgent need for a COVID National Cancer Recovery Plan. I have received no replies to any of this correspondence. Mr Deputy Speaker, does the Secretary of State just not like me, or does this point to a bigger issue with his department?
Mr Deputy Speaker, we have spoken about this in this House, and it is absolutely true that during the peak of the crisis, the department was working incredibly hard and absolutely flat out, and we're now working hard to catch up on our correspondence.
Video link. Bob Blackman.
Thank you, Mr Deputy Speaker. And as part of the reopening of pubs and cafes and restaurants, they are being encouraged to open in the open air. Now, that has implications for people who do not smoke. Now, I understand that the government will be issuing guidance for smoke-free areas outside pubs, restaurants and cafes. Can my right honourable friend confirm that his department will be consulted on these proposals? They'll be issued before Parliament rises and be the subject of parliamentary scrutiny.
Deputy Speaker, I can certainly confirm that we will be consulted on these proposals as they are brought forward. I haven't yet seen them. I know that work is going on them, and I think they're incredibly important. And I think it's important that parliamentarians like him, who have a long and proud history of fighting smoking and the consequences on people's health that smoking brings, not only to the smokers but to others, to make sure that those considerations are brought to bear as we bring these forward. He knows what I think.
Video link. Barry Shearman.
Thank the Secretary of State. I think he will know that I have a reputation in the past for being a bit hard on him, but in recent weeks he has been, and his team, been very supportive when there have been challenges in my own part of the world. So can I thank him sincerely for him and his team's actions in that and a good communication. Can I just say one thing? There's a news story today that there is a rise in infections in France. There is another surge. This dreadful virus is still there, but would he agree with me that more firm leadership on the importance of wearing masks is very important indeed? And will he take my assurance that the anti-vaxxers have to be confronted? I have just seen statistics that a quite high percentage of NHS employees are very resistant to getting the flu jab in the winter. That is a great challenge. Altogether, would he agree we can face it down?
Yes, I like the new Barry. It's like the old. It's like the old Barry before he got very cross with me over Brexit. And welcome back. It's really nice to see you. It's also, if I may say so, and I'll make this clinical point, which I normally avoid. It's really good for your blood pressure. We've been working really hard with Huddersfield and with the local authorities in his part of the world to bring the virus under control, and it's been a real team effort and an example of how things should be done working together. And I appreciate his words on that, and I hope that the whole local team will see that this is a big cross-party effort and there isn't some sort of fake attempt to create division. This is everybody working together to try to tackle this virus, which is how it should be. On the latter point, I agree with him very strongly on tackling the anti-vax movement. He's quite right to raise it, and he's quite right to raise the importance that this isn't just about the COVID vaccine; it's about the flu vaccine too. And we are moving to make sure that a far higher proportion of people in the NHS who get the flu vaccine. The expectation will be this winter that every single person who works in the NHS will get the flu vaccine unless you have a very good, essentially clinical reason. And making that happen is a big part of the work that I'm doing with Simon Stevens and the NHS leadership to drive that through.
Dr. James Davis.
Thank you, Mr. Deputy Speaker, and I thank my right honourable friend for his statement. He referred to an additional £3 billion for the NHS to help keep the temporary Nightingale hospitals open over the winter should they be needed, and also to keep non-COVID sites available for routine healthcare. Will he confirm how this funding relates to Wales?
Yes, Mr. Deputy Speaker, I imagine you might have an interest in this too. The extra funding announced on Friday by the Prime Minister, of course, also means that we'll be increasing the funding that goes to Wales and Scotland and Northern Ireland because you can only provide a high-quality response to this disease if you have the financial firepower to be able to support your NHS and the action that's necessary, and that is only possible because we have one united kingdom. In Scotland, they'll be receiving an extra £250 million with which to tackle the disease. In Wales, they'll be receiving an extra £150 million with which to tackle the disease, and in Northern Ireland, an extra £90 million. And it means that across the UK, we can fight the disease better because we're all part of the same UK.
Angela Eagle.
Thank you, Mr. Deputy Speaker. Baroness Harding told the House of Lords Select Committee earlier this month that people were unwilling to self-isolate because of financial pressures. We also now learn that test and trace doesn't make the same inroads in poorer areas as it does in more well-off areas, where the pressure to self-isolate or not self-isolate because of financial pressures is going to be higher. So can I again ask the Secretary of State, can he make an announcement about sick pay and access to extra help for those who need to self-isolate but who perhaps cannot really afford to do so?
Well, the Honourable Lady makes an important point, but the number one cause of people not self-isolating is if they have symptoms or they have coronavirus without symptoms and don't get a test. And that's the area where we need the most effort. I hear the point that she's making, and I'll take it away.
John Howard.
Thank you, Mr. Deputy Speaker. Is my right honourable friend aware that cotrimoxazole is receiving tests against COVID in Bangladesh, and that the results from there and India will be published very shortly, with increasingly good results coming out of that? And when are we likely to see it in use here?
Mr. Deputy Speaker, I will immediately look into this this proposal. I would be surprised if my scientists aren't already across the trial, and we'll make sure that if there's a positive signal in that trial, we will absolutely bring it forward.
Video link, Vicky Foxcroft.
Thank you, Mr. Deputy Speaker. Today I wrote to the Chancellor and the Business Secretary on the need for more support for those high-risk people currently shielding. Does the Health Secretary agree it is essential those currently shielding have faith in government advice? And if so, will he commit to publishing a full risk assessment for each category on the shielding list before the 1st of August? Health Secretary, now is the time to use the full capacity of government communication to reassure people. Will he?
Mr. Deputy Speaker, I agree very much with the sentiments of what the Honourable Lady said. The challenge is that the number of different groups within shielding is essentially as big as the number of people who are shielding themselves. And so we've taken the approach that individuals will get individual clinical advice on what's right for them, and that is the best way forward.
Andrew Salu.
A young couple contacted me over the weekend to ask why it is that any number of people without restriction can spend the whole evening in a pub eating and drinking, and yet as from the 1st of August only 30 can go to a wedding reception. Is there any comfort that the Secretary of State is able to give people in that position?
Well, the explanation is that in the pub they will have to be socially distanced at 2 metres or 1 metre plus mitigation. And that we, unfortunately, this virus is still at large, and so having very large groups of people in a situation where it's absolutely normal to be in very close contact is a risk. These are all judgments, and unfortunately, this is one of the judgments that we've had to make.
Catherine West.
Thank you, Mr. Deputy Speaker. COVID, long COVID and lockdown are creating a tsunami mental health crisis. My own mental health trust has lost 4 black and minority ethnic workers in the line of duty in the front line of the National Health Service. What is the plan to provide a comprehensive mental health strategy which meets the challenge, particularly for young people or for people who never thought they would ever have a mental health crisis, and to meet the workforce challenge so that we can actually have a plan in the autumn for what is going to be a very difficult, emotional time for people who've had COVID or lockdown stress?
Yes, Mr. Deputy Speaker, there is undoubtedly a challenge of people who haven't come forward during lockdown and are presenting now with severe mental health problems, and it's something that I'm working with both the NHS and also the Royal College of Psychiatry on. There is good news that for treatments, for non-pharmaceutical treatmits, there is evidence that they are better done by telemedicine, and psychiatry can be better done by telemedicine, which helps, but obviously that doesn't help at the most serious end of the cases of mental ill health, and it's something that we're working very hard on.
Caroline No.
Thank you, Mr. Deputy Speaker, and I'm sure it will come as no surprise to my right honourable friend that some of the solutions come from Southampton, and I would like to commend the work of Synergen in the treatment that they're producing. But I'd specifically like to ask him about vaccinations. It's crucially important, not just that we put the anti-vax argument to bed, but equally that he provides reassurance to those who might be anxious about a vaccination for COVID. Can he provide us with any information on what plans he has for a reassurance programme?
Yes, we are planning to provide exactly the reassurance that she seeks in 2 ways. The first is the essential point that we will not approve a vaccine until we are clinically confident that it is safe. And we would never approve a vaccine unless we were clinically confident that it was safe. The second is that we will also have a communications campaign. And to answer a point that somebody asked earlier that I didn't answer at the time, we have already published a plan for the order in which people will have access to the vaccine, starting with the most vulnerable, and it essentially consists of going down by age, through those with comorbidities, and health and social care workers. So we've got to make sure that we reassure people and we assure them that we're doing this, the rollout in a clinically valid way. And finally, on Southampton, my right honourable friend is an assiduous representative of the environs of Southampton. And I think when Southampton's doing well, Rumsey is undoubtedly part of Southampton. And in this case, Southampton is doing very well, and let us hope that it continues.
Ben Bradshaw.
Doesn't the fact that local public health directors are only getting access to the individual data that they need to avoid another local lockdown from today, and only if they sign a data protection agreement, illustrate the government's slow and over-centralised approach has been a problem? And why would a local public health director not sign such an agreement?
Well, I doubt any would, but we've got to make sure that people are assured that their data will be used sensitively. And on the timing, we've been constantly improving this throughout the process. You know, some people complain that that everything isn't done by yesterday. Well, there was very little that was you know, we put this together in a matter of a few months, and I think he'd do far better standing up and supporting the work to put together this amazing programme in a few short weeks, rather than sniping from the sideline.
Sarah Brickcliffe.
Thank you, Mr. Speaker. As my right honourable friend will know, my neighbouring constituency of Blackburn now has the highest infection rate in the country, and my constituency of Harman and Haslingden is served by Blackburn Hospital. My constituents are quite rightly very concerned. As a local lockdown seems very possible, can he assure me that the department will engage with myself and local authorities closely going forward to provide the guidance and advice needed?
Yes, absolutely. She's quite right to say this, and she's already been in contact and making sure that she represents Lancashire and the needs of people across her area and across Lancashire. And I absolutely commit to doing that. And I commit to working with MPs in all those areas that are affected across the country. I know how concerning this is to to constituents in an area where it is in an area with a much higher rate or close to an area with a much higher rate. A case in point has been the MPs in Leicester and across Leicestershire with whom we've worked very closely to try to tackle this problem. And I know that my honourable friend will do a fantastic job looking out for the interests and the needs of her constituents.
Charlotte Nichols.
Thank you, Mr. Deputy Speaker. Mercifully, our local R rate in Warrington is low, but I am concerned about surrounding areas that many of my constituents commute to for work, and that local authorities have not been getting patient identifiable data which would help them quickly identify and address workplace outbreaks. I welcome the Secretary of State's assurance that local authorities will be in receipt of this information from today, but what powers will local authorities have to coordinate data sharing with each other to sit alongside this?
Yes, if a local authority, say an upper tier local authority, gets the data and wants to conclude a further data sharing agreement with a lower tier local authority, then they're absolutely open to do that.
Stuart Anderson.
Thank you, Mr. Deputy Speaker. I would like to pay tribute to the hard work and sacrifices by the amazing people of Wolverhampton. Will my right honourable friend stand with me in this and also ensure that whenever they need testing, they can easily still get access to it?
Mr. Deputy Speaker, I stand with my honourable friend and with the people of Wolverhampton in saying that if they need more testing, they'll get more testing. But right now, I know for sure that anybody in Wolverhampton who needs a test can get a test. If you have symptoms, if in doubt, get a test, because that is the most important thing that you can do to help control this virus across the country.
Video link. Martin Day.
Thank you, Mr. Deputy Speaker. Independent Sage has estimated that another 27,000 deaths in the UK by spring, without a second wave of the virus, if the UK government continues with its current approach. So will the Minister agree to follow Scotland, Wales and Northern Ireland's examples and pursue a strategy of eliminating the virus, rather than accepting the terrible projected death toll that living with this virus will cause?
Mr. Deputy Speaker, those projections did not take into account the actions that the UK government is undertaking.
Laura Ferris.
Thank you, Mr. Deputy Speaker. I welcome the news that we heard today about the successful trial of the Oxford vaccine. The question that is on the forefront of my constituents' lips is when that will be available on the market. Now, I know my right honourable friend can't give those assurances, but could he assist my constituents by saying, firstly, when the trial is due to come to an end, and secondly, give assurances that the route to market of a successful vaccine will be as quick as that for dexamethasone?
On the first point, I'm afraid I can't give her the clarity which she understandably seeks on behalf of her constituents, because it's a scientific question. As the rate of new infections has come down, so the clinical trials have had to be a bit longer, because you're trying to prove a negative, that if you've had the vaccine you don't then get the disease. As a result, AstraZeneca have taken this vaccine around the world to put trials in to countries where there is a much higher rate of infection. And the rule with clinical trials is that as soon as a trial comes to a conclusion which is beyond reasonable scientific doubt, then they immediately bring forward the results. So I'm afraid it isn't a trial with a specific end date. It's a trial that runs until it has concluded scientifically one way or the other. I hope that explanation is as good as well, it's not as good as a date, but I hope that people will accept it as much as they might accept a date. On the second point, she's absolutely right. We've been working hand in glove with these brilliant scientists. The MHRA, we should put on the record, Mr. Deputy Speaker, even if I might take an extra 30 seconds to say it. The MHRA have done an amazing job. They have been alongside the scientists. They've made sure that the trials are designed so that they can approve the results as soon as the results come forwards, rather in parallel, essentially, rather than afterwards, which would be the norm and typically the case. They have played a blinder. They are one of the reasons that the UK is at the forefront of this on vaccines and on treatments. That means that, yes, the vaccine will be available as soon as humanly possible, as soon as the science is proven.
Jim Shannon.
Thank you, Mr. Deputy Speaker. Can I first of all thank the Secretary of State for his commitment and his dedication? And can the Secretary of State give detail on the difference between reporting statistics which allows someone, in the case of my constituent, who was in end-stage heart failure, had a mild dose of coronavirus, no symptoms, yet cause of death on the birth certificate was noted as coronavirus, crying the implication of closed casket and possible misleading statistics? And does the Secretary of State not agree that we need to be clear if someone simply had coronavirus or if someone died directly due to complications from coronavirus?
Yes, teasing out the answer to that question is a very difficult statistical task. The broad point he makes, though, is the right one, which is that we are seeking to tackle this disease of coronavirus, and we should try to measure that. At the same time, of course, we need to continue to tackle all the other diseases, and we need to make sure that the consequences of those diseases are measured properly. This is it's a very significant challenge. It's one that many countries around the world face, and it's why the scientists cast some doubt and scepticism over the over-analysis of international comparisons of deaths data, simply because of just how difficult it is to get this right, as proven by the need to put in place this urgent review after that I put in place last week.
Greg Clark.
Thank you, Mr. Deputy Speaker. As my right honourable friend knows, if we're to suppress the virus, we need an agile and vigorous response. 6 weeks ago, I asked my right honourable friend to ensure that tests were available to elderly residents, not just of care homes, but to residents of sheltered accommodation and retirement villages. 3 weeks ago, he told me that they would be rolled out in 3 to 4 weeks. So can my right honourable friend confirm whether this has now been completed or will be, at least by the end of the week?
Mr. Deputy Speaker, I will bring the answer to this question to my Right Honourable Friend's Select Committee tomorrow. I had commissioned an answer to precisely this question ahead of that appearance, and I was hoping that my Right Honourable Friend might ask a different question today, but I've been found out.
Caroline Lucas.
Thank you, Mr Deputy Speaker. A test, trace and isolate system that holds public trust is absolutely vital. So can the Secretary of State explain why he considered the data protection assessment as optional? And how will he deal with the mistakes that come to light, such as contact tracers sharing patient details on social media reported by the Sunday Times? In short, how will he increase trust in this essential system, given that bullish statements are no substitute for due diligence?
Mr Deputy Speaker, I will not be held back by bureaucracy. And in the case of the data protection impact assessments, we made 3 such data protection impact assessments which cover all of the necessary. And I've seen that there was a report saying that we should have done 1 to cover all 3, but we did the 3, and I think that'll do the trick.
Lee Anderson.
Thank you, Mr Deputy Speaker. At the start of the pandemic, I raised the issue of care homes potentially losing revenue due to COVID and run the risk of closing down. My right honourable friend advised me at the time that no care home in Ashfield would close. Could my right honourable friend please update the House on the extra support given to care homes and advise if any have closed due to financial constraints caused by COVID?
Well, we've worked very hard to support the social care sector, and exactly as the Honourable Lady asked earlier, making sure we get that financial support in is important. Of course, in the first instance, the local authority is responsible for ensuring that there is there's available care homes to put people in. I'm very happy on the specific details of Ashfield to look into them and to write to my honourable friend to make sure he gets a proper answer to the question.
Sian-Mura.
Thank you, Mr Deputy Speaker. And before asking the people of Newcastle or any city to undertake a local lockdown, government must provide clear national guidance, good local data and better local resources. 80% of those traced are reached by local authority and public health teams. Surely they deserve a greater proportion of the 18,000 test and tracers recruited nationally. And COVID-19 was made a notifiable disease on March the 5th with a legal requirement to notify local authorities. He's telling us he's only just sorting out the data protection issues of that now.
On the first point, of course, it's a big team effort, and she's quite right to raise the 3 areas that she has, and that's exactly what we're delivering on, making sure that people have the high-quality data, making sure that if we need to put in more resources like more testing, then we do that, and making sure that there's money that goes to the local directors of public health, which we have done, and making sure that we get the high-quality links between the two. And so we're making progress exactly against how she sets it out. If, in addition, she's seeking a threshold, a figure, at which point a local lockdown is triggered, we're not going to do that. And the reason we're not going to do that is you have to take everything into account, including local circumstances. For instance, Mr Deputy Speaker, last week the number of cases in Herefordshire absolutely shot up. And on some counts it became one of the places with the most cases in the country. But we know that that was confined on one farm, and so far better to tackle that one farm than to shut down the whole of Herefordshire. It's a clear example of why this call that keeps this simplistic call for a single threshold is not the right approach. What's the right approach is a scientific approach using all the available data and people's judgment.
Alexander Stafford.
Thank you, Mr Deputy Speaker. The Secretary of State will know that many people in Rother Valley don't own cars and public transport is often woeful. So will he support putting mobile testing units in Maltby and Dinnington so that everyone who needs a test can get a test?
I will look precisely at putting mobile testing units in Maltby and Dillingham and look at, again, the local data along with the local authority and see what we can do.
Video link, Debbie Abrahams.
Thank you, Mr Deputy Speaker. I also welcome the Health Secretary's change of heart and his assurance that the complete Pillar 2 testing data will be sent to local public health departments each day and not each week. The delay has inhibited local public health departments' ability to contact and trace COVID-infected people, letting the virus spread in some areas. Given that many of us have been asking for these data for a number of weeks now, what is the Health Secretary's assessment of the number of people who've been infected as a result of the delay, the impact on public confidence, and the hit that local economies will take because of these failures?
Mr. Deputy Speaker, we've been building the test and trace system and improving the data that flows from it and underpins it all the way through this crisis. And I'm glad that she's pleased on the continued progress that we're making. That's the way to look at this. We've been building this extraordinary service at extraordinary pace, and I'm really glad we're able to get more.
Nasrat Ghani.
Thank you, Mr. Deputy Speaker. I welcome the Health Secretary's statement and I share his concerns that we do not know how the virus will react when we enter our cold season, our cold weather. Wilton constituents are already concerned about winter flu. Can I ask my right honourable friend that when he has the data on cold weather and the virus that is shared with East Sussex Health Trust, East Sussex County Council and Wilton District Council, so we can both prepare and be rightly resolved to deal with both COVID and winter flu?
Yes, I'll do better than that, Mr. Speaker. We will, when we get scientific evidence on the impact of the cold weather on this virus, we will publish it.
Video link. Graham Morris.
Thank you, Mr. Deputy Speaker. I hope the Secretary of State is aware of the tragic case of Kelly Smith, who sadly died when her cancer treatment was stopped during the COVID lockdown. The government's aspiration to get cancer services back to normal by the end of the year is simply not acceptable. Too many cancers are incurable within a few weeks. Can the Minister address this issue, and will he look at transforming radiotherapy services which have emerged as being highly effective as a cancer treatment which can be delivered even if there is a second spike in the pandemic?
Yes, absolutely. The right honourable gentleman is absolutely right about the importance of this. We're getting cancer services back up and running as fast as possible. The idea that we're waiting until the end of the year before doing anything is completely wrong. We're going as fast as we can. Now, during the peak, some of the services did have to be stopped for clinical reasons because it was, although my heart goes out to those who died of cancer whose treatment was stopped due to COVID. The judgments were made on an individual clinical basis as to whether it was safer to go ahead with the treatment or to stop it because, of course, many treatments for cancer are much more dangerous when there's a high amount of infectious disease. So that explanation will be no comfort to Kelly's family and friends who mourn her. I understand that. But I also understand why the NHS made that decision, and I support them in the decision they made. But we must get this going again as fast as possible. This is something I'm working very closely with the NHS on. In fact, I had a meeting on it only last week, and I think that I entirely agree on the point about radiology services too.
Aaron Bell.
Thank you, Mr. Deputy Speaker. Could I invite the Secretary of State to join me in congratulating two Staffordshire organisations, one in the private sector and one in the public sector. The private sector firm is Cobra Biologics in my constituency of Newcastle-under-Lyme, who were one of the first manufacturers of the Oxford vaccine, have scaled up to produce more even before AstraZeneca came on board. And the public sector one is the Staffordshire Resilience Forum. Thanks to their hard work and the hard work of the people of Staffordshire, they've now been able to downgrade their major incident with coronavirus, though of course we cannot drop our guard completely, but the situation is now currently stable and under control, and I think this illustrates our response to coronavirus.
Mr. Deputy Speaker, I want to pay tribute to the public health services and the NHS and the councils across Staffordshire who have worked so hard to get this virus under control and have really got it right down in Staffordshire, including in Newcastle-under-Lyme, which, of course, my honourable friend regards as the finest part of Staffordshire. The point that he makes, the first point that he makes, is also absolutely valid and something I'll consider going forward.
I'd like to thank the Secretary of State for his statement today. Please take care when leaving the chamber. The House is suspended for 3 minutes.